Today I'll be talking about smoking. At first glance, smoking may seem to be harmless for teens, but can actually be dangerous. The dangers of smoking with teens can be affecting someone you know or even yourself. Studies have shown smoking can have negative lasting effects into adulthood when teens who smoke. Lack of awareness of this information can be detrimental to one's health, especially if smoking is consistent among teens. Today, I will describe how smoking is an underlying issue in America that many teens have been introduced to, and explain how it can be linked to 3 primary health complications, and discuss possible treatment to quit smoking and increase individual mental health. Therefore, smoking is a serious issue in America that needs to be addressed more often as it can lead to the development of lung cancer and raising serious concerns. In the US, cigarette smoking is linked to about 80 to 90% of lung cancer deaths that have been caused by smoking in teens. There are advertisements that are targeting teens every day with interesting flavors and ways to smoke. According to branding, major corporations are targeting teens with an assortment of flavors that make smoking seem all that sweet. The problem with this is that teens are being manipulated by the sweet aromas to know they're actually putting toxic chemicals into their body. Smoking at such a young age can be a premature cause of lung cancer, and is why teens should try to avoid it as much as they can. According to Brandy, researchers have been finding correlation from teens smoking to have prolonged complications that are a result of lung cancer. If we were able to stop teens from smoking, we will be lessening the curve of lung cancer patients and help in the continued growth of the mind in teens, as the mind is still developing. Furthermore, teens are falling for companies' tricks is because they are unaware of the concerns it raises and seem to neglect the way it can destroy your health over time. Smoking may not be that big of a deal for teens today, but for the future can lead to heart disease and failure, and accounts for about 1/5 of the deaths from heart disease. Teenagers have the tendency to ignore warning signs and feel as if they try a little or did something of it, nothing will come from it. According to Cameron, teens' attention span to warning signs are low as the use of social media has blocked their minds from recognizing they are in serious danger. Teens will see other teens smoking and see it as an invitation to join in without truly understanding what they are getting themselves into. Heart disease affects about 3,000 people a year and must have been premature and started back in their teen years, and have been consistent smoking and making it worse for their heart. According to Cameron, heart disease is a serious problem in America, and one cause can be premature smoking. Teens are little by little becoming more unaware of the effects of smoking and not realizing the outcome it can have and possibly lead to heart failure if you do not get a checkup from it right away. The way smoking is so strongly addictive with teens is that they are not used to the drug that makes it that way, and sometimes may use it as a way of coping or just for fun. Nicotine is an addictive drug found in smoking and can cause high-risk health complications from raising blood pressure and can lead to a stroke or even worse. Nicotine is a drug that can get you hooked, and if you are unaware how effective it is, you may find yourself not quitting anytime soon. According to Dr. W., a doctor from USC Medical, nicotine is an addictive drug such as oxy or morphine, and when you're not properly able to handle it, withdrawal may seem harder and may worsen the effects for the patient. Having a good support group can help with withdrawal, and simply avoiding the drug from being inputted in your bloodstream is a proven way to help with it. Carl states, smoking can cause major health concerns, primarily high blood pressure, which is not added weight teens should be worried about or should even have, as it can lead to stroke or worse. The underlying causes of smoking when you're a teenager can be life-threatening, especially if you're unaware of how addictive it can be. Smoking is an addictive drug that makes it more harder to quit and likely for teens, and is consistently taking up smoking longer, which can lead to an increase in heart failure. Today I describe how smoking is a serious issue in America that many teens have been introduced to, explain how it has been linked to 3 primary health complications, and discuss the possible treatment to quit smoking and increase one's mental health. As you can see, if teens are not aware of the complications that come from smoking, they will likely be decreasing their lifespans one day at a time. We should be able to stop smoking, as it is a serious issue that we tend to neglect in America. But it has been an expanding factor into communities, and more having serious health problems from it. Becoming aware before you do something is a way to be well informed and inform others and help lessen the health issues from smoking. Thank you.